Okay, so good evening, everyone, and warm welcome, Ajay, to this our session on Zoom. We are all family here. Everyone, I think most of us know each other. So, how are you feeling? You've passed the MRCPCH clinicals. So, what time did you get the results? What time was it when you came to know? Did you check yourself?
So actually,
Yeah, you are.
no, my
Hmm.
friends and my wife had checked. So I got to know very late. By the time it was evening, I think by the time in India it was night. I think when I got to know.
Just tell me, we were talking early in the morning because you were actually in UK in the greater. You are right now in UK, aren't you? You're not in India right
Oh,
now.
yes. Not in India. I landed the same day when the results came.
So
I
that
mean,
was
by the time
yesterday.
yeah,
So what time did you
yes, sir,
land?
yesterday.
So you landed in the UK and
Around 11 p.m. 11 p.m. sir. Here
11 p.m.
around
at night.
5:36.
Okay.
Yeah, in
So is
India
that
time. Yeah.
so you landed in UK and is that when you came to know the report results?
I got to know about the result has come. Yes, sir.
Around what time would that be? Around
Here at 6 p.m. 6 p.m. around evening 6.
okay. So for there you came to know as soon as you landed. So that's a
Yeah.
landing with a bang. That's what you say. You just landed and you passed the. So that's a great thing,
Yes, sir.
isn't it? That's so lovely. Uh, okay. So how are you feeling? How would you describe your feeling? What's your that's just the feeling. Is it more of relief or is it more of abundant joy or is it just sinking in? How would you say it is for you?
So I think it's still sinking in. I mean,
Okay.
I know MRCPCH is just an entry, so
Yeah.
I think a
But
lot
still
of
it's a big
things
thing.
are, yeah, so,
Don't underestimate. See, don't get the feeling that, oh, finish and already, arey, to kuch nahi hai, abhi so much of things ahead of. It is important in life that you mark each success and you celebrate it. Otherwise, in life, I'll tell you, don't feel that's gan, but take it from a senior person. There'll be, one hour. See, you've worked hard for it. It's not something which comes easy, yeah. And unless you allow yourself to celebrate it and you enjoy it because you deserve it,
yes, sir.
otherwise there's no end to your what do you call your progress in life, isn't it? There's always something next, yeah. And then it will be very depressing. Then you'll find that you're never really happy. You'll always feel that, oh, I've come here, I've got something else. And what is life? That's what life is. And that's why some people will see they have got very high degrees and still they are not happy and they're suicide, that problem, this and life is short. You've come so far, you've done more successful than other people. So I think we should be, I'm sure you were worth it. You did all your, I remember the discussion we had in Hyderabad. So that's pretty good. So just tell me your very brief background, where you are based, what you've been doing, just so that people, they know what you're doing. Yeah.
Yeah. So I'm Dr. Ajay. Uh, I've passed my MBBS in 2012. I think it's in 08 batch, 2008 batch, and from Mysore Medical College. And I've done my MD pediatrics from Maulana Azad Medical College, Delhi.
Okay.
From Passed in 2018. So
Yeah.
after that, I was worked 1 year as a senior resident in Lady Harding, and I've done a 2 year fellowship in pediatric nephrology.
Yeah.
And at present, I was working as a pediatric nephrologist
Yeah.
consultant at Rainbow Children's Hospital, Hyderabad.
Correct.
So I've seen a lot of. It's Rainbow Children's Hospital, Hyderabad was a proper corporate hospital. So
Okay.
I've seen a lot of consultants who's trained in UK. The way they approach and the way we used to approach was very different. So I felt that, probably even the general pediatric skills were little, I felt that they were a little different because as I've been trained in nephrology, so I feel that I was getting very limited. But then taking up this exam made me realize that, in general pediatrics is as much as necessary to deal with such specialties also.
Okay.
Yeah.
Mhm. All right. So that's what I was going to ask. So when did you decide that, which I guess you answered anyway, that how did your MRCPC journey start? What made you really feel that, this is something I want to do? Because you are MD already, is it? Have you already done your
Yes, sir.
MD? Yeah. So what point did you think, no, I really need to do the MRCPC? Is there someone ahead of you, or what was in particular? You just want to go abroad to work, or just another degree? I was curious.
Like I said, when I started working as a consultant after a year, I felt that I'm doing the same work. Like, I mean, I was building up a lot of patient base also,
Where
but I
were you
felt
based
that,
at that time? In Hyderabad, sorry. Where was it?
Oh
Isn't
yeah,
it?
yes, sir. I was in Hyderabad. From
In the Rainbow
2021,
Hospital?
I was in Hyderabad. Yes, sir.
Okay. So you're already established, really. What most people want. You're established as a consultant, one of the top hospitals in Hyderabad, Rainbow. You were doing successfully, but even then, there was something which was, well, felt you lacked or you wanted something more. Yeah, carry on. Sorry, I'm just summarizing. Yeah.
Yeah, yes, sir. So I felt that probably I mean, I've seen many of one of those colleagues who were there. They were all trained. They were like trained in UK, and then they went to Australia. They stayed in 20 years. So my who is my mentor also.
Okay.
And one more, my colleague who is also trained in UK is a pediatric endocrinologist. So they were all very telling about the training and how they approach. I was actually inspired by them, seeing
Okay.
them. They even any child comes to the OPD, they don't look just at once. They talk about their family. They talk about how they do, what they do, about the parents. Because we sit in OPD, we're like finishing the numbers, seeing the just disposing the patients,
Yeah.
and so we were doing in our MD also because we had so much load to see.
Yeah. Yeah.
So even with that load, actually they were trying to inculcate what they had been doing. So I was like, I was inspired by them. So I
Mhm.
started this in I think uh 22. I started
Your
my
MRCPCH journey.
MRCPCH. So in
Okay.
October I gave a FOP task, and then I took it in May 23. I gave AKP, and this January 24 I cleared my clinical.
Okay. So that's interesting. No, that see, you were successful in everything, but you just felt saw your seniors and colleagues, senior colleagues, and you just noticed the difference in the approach they were in the clinics, isn't it? And that's what I guess everyone who's doing the training know. And that's why we had the last session on was yesterday, I think, that we had on what you call on something. We talked a lot about empathy and we talked about compassion and how that is a more total approach, 360-degree approach, rather than just on medication and treatment and diagnosis. I think that's what you're referring to. Yeah. And
Yes, sir.
so that is very, very good. And obviously you are joining one of the top hospitals. How did that happen? Great Ormond Street is a dream. It's like the AIMS of India or the PJ Chandigarh of India. To join in Great Ormond Street, congratulations for that. Don't
Yes,
underestimate
thank you, sir.
yourself. It is very few people get a chance there. Okay, you have to be really best of the best to join in Great Ormond Street in Calcutta. I've been there, but just do some courses. I never worked there really, but I wish I had. So just tell me how that happened, because that's part of your journey. Because even before your job, you got a posting there. Yeah.
So actually, like I said, I was trained in nephrology. So I was interested in doing further fellowship or any few more experience here in nephrology.
Yeah.
So I had applied for a and fellow post at Gauche. I did interview, but I was fifth of 8 candidates. So
Okay.
I had mailed them that look, it was the next when it will be the next post will be released. They said they've already hired for the next post, but
Okay.
they then I said I've done my MRCPCH for part one, part two. So clinicals is only left. I'm okay to do general ped job. So then they said you have to look for any general ped posts, and then we can see. So luckily at that time, one post came through. There's an IPP blog,
Okay.
International Private Patients Wing in Gauche.
Mhm.
So through that, and it was MTA sponsored post. So I had applied, and I underwent it. I mean, application got selected, and then also did an interview. Interview went well. Before that, I had given one more interview at Doncaster, but they was more of neonate and pediatrics.
Okay.
So maybe they did not accept because I didn't have much neonatal background. Because last two
Experience.
years I had done only nephrology, and I was doing general pediatrics OPD that they didn't consider much over there.
Okay.
So, but gosh, I think as a private international private, they're mainly seeing other this patients from like embassy referrals, like in Saudi or
Okay.
Dubai-based refer patients over there. So they said they wanted a diverse population of
Mm.
doctors. So
Okay.
then I got hired for that.
Okay.
So I think I should be starting by next Monday mostly a
By
here
next
job.
Monday. So you got some place to stay and you're looking for a place to stay and accommodation and all that, I guess.
Yeah, I'm staying in my
Yeah.
friend's place now. And
Okay.
probably a day or two
Mm.
I'll move to
Do
one more
so.
accommodation. Yes.
Okay. So is it cold there? Pretty cold? Or are you feeling?
It's cold, so it's around like 6 degree or something.
6 degree,
It's
pretty
not
cold.
much better now. It's got 9 degree. Yeah. Night
9 degree. Okay.
it was very cold.
That's it. Now, tell me about obviously when you did your MRCPCH, the whole process. Obviously, theory is one part, more of theoretical knowledge. But when you started with your clinical, what was your main challenge? Which you felt was this is something I'm really see. You guys have already done your MD and you know all your stuff. You've done Nelson and all, so you guys know your theoretical stuff. Yeah, you've done an MD, I think. So where did you find was different? Where did you find this is something I need help? And that's why you joined our clinical, obviously, clinical course. What was it that you felt I really need to know this properly? Or this is a challenging
Uh,
for me.
yes, sir.
Yeah, carry on.
So, I mean, I felt that the history taking part, and I mean, for me, mainly for me, it was a development which I really needed help because
Okay.
I finished my MD in 2018. After that, I we literally not touched development because I was entirely into the nephro part where we hardly had to see development. We used to refer to the developmental clinic. So I felt that, I did not have any, I mean, I lacked myself that courage.
Mm.
So for that, for that, I thought I'll get exposure, how it goes. Maybe I'll
Okay.
attend, I will take the hot seat and I will answer. So that will also help me to gain some confidence because that's what I think the ultimate thing is you practice, then it will help you out there.
Absolutely. And I think what you mean is, so like, this happens to many of our students, because a lot of people come here, they are more educated than us. A lot of people, candidates here are DM. So they have been doing suppose neonates only. Or someone has been doing only endocrinology. And they say to, when they join us, they say to us that, see, we are DM, but the thing is, we've forgotten a lot of basic pediatrics because we are out of touch with clinical pediatrics or even handling a neonate. And suddenly it's going to be difficult for us. So that's why a lot of people join the course because and again, I guess what you have here is a hot seat where you are, you have this pressure of getting the case scenario. It's like a mock test every day, in fact. And you've got people around you who will be judging you. Obviously, that your mentor or examiner right here. And also your fellow colleagues will be judging you. And as you know, we give a chance for everyone to correct you. But do you think that pressure helped getting you? Did that, every time coming on the hot seat and being, having to work on time and being judged by everyone, was that, or being on the spotlight, was that something which was useful?
Yes, sir. So
Mm,
initially when I joined, I think I joined the June batch, so I was
mm,
more of a listener. But since we started December, I think only four of us were there. So me,
yeah,
Sabarni,
yeah,
Ruchika, and Jay Lakshmi. So
yeah,
that we often used to get hot seat. So it's like, so whenever we take hot seat, I feel that the more it's more of a practice session. So I mean, we have to listen to the other people, but sometimes we have to analyze ourselves. That also helps. So I was
mm,
analyzing myself during each that whether the first one I did and the last one I did, how much I had improved. So that also takes. I mean, self appraisal is also needed. Sometimes you have to see how we are doing. And
mm,
each time when you take a hot seat, and next time when you take a hot seat, you will find a difference if you do the self
okay,
analysis how you've done. So
okay,
that will help if you're taking a hot seat.
okay. So it is about reflecting on where you were last time, where were the obviously the reviews you get the feedback which helps you to understand where you shortcomings are, so that next time you do, then you can feel the difference. That yeah, these were the problems earlier. Now I'm otherwise it's no good, isn't it? Otherwise, how do you improve? Yeah, and I guess the important thing is to get a proper feedback. Yeah, the it has to be really honest, brutal feedback. Yeah, otherwise it's no good. You don't have to take it personally.
Yes.
That would help. So that's good. Now tell me about the day of the exam. So when you went for the just a brief outline or a summary of the day you had the exam and you had the different tables, I think this is very important for the candidates. And I think please spend your time on it. I think everyone will agree. When you state your state of mind when you entered the day of the exam and how you went through table, what because you told me in brief, but what was happening at different tables and what are the lessons, what advice at the end of it, having gone through it, what was the mindset which would have helped you? Do you understand? Or which did not help you? Please tell, because that
Yeah.
is the most
Yes.
important thing, the day of the exam. Please carry on.
So, so as you know, they will give you a circuit. So my circuit started from communications, and then it turned off from communication AB, and then video AB. Then I moved to clinical, short clinical. So it was a short clinical. I was in station 4, where I really, when I went in, I literally went blank. I
Okay.
did not know what, I mean, I had washed my hands, but I really felt in between, I felt that, I did not wash my hands. even though they didn't say anything, then nobody says anything. They just
Mm.
ask you to examine. It was a case of rickets. I did something. I felt I did not do well. But when I came out of the station, I really felt that this station is gone,
Okay.
and it was I did not expect it. I mean, but I had to think the other three stations which I had to buck up. So the next station was a which I thought in this whatever happened has happened. So next station I have to do well. The next station went well for the CNS station. They just asked me to do a cranial nerve examination, so which I could do, and actually I've got full 8 out of 8 in that. And this next few sessions are all well, and even the development station was also like it's kind of a syndromic with a neuroregression, but they didn't ask about syndrome. Even because
Okay.
we couldn't make out when they said it was a short face or wide eyes,
Mm.
wide mouth. So I couldn't make out which syndrome, but they didn't ask what syndrome,
Okay.
what to do. But probably one of the DDs they asked.
Okay.
And few things we tend to miss because we are in a hurry because we are always ticking the boxes. I missed asking about consignment in the marriage in the
Okay.
development.
Consanguinity. Yeah.
That was one thing which I missed. But I later, then when we were having discussion, he asked you to ask consignment. I said no, I did not ask. I
Okay.
had to tell the whatever we had asked, we had to inform.
Okay.
So history was development, and history was my last station for me. I ended with history.
So one of the things which I would say is that there were moments where you went blank, which happens to me, which happens to most people. I think that's what you're going to say. So I guess what people have to know here, yeah, hi Shaboni, thanks. You can just wait, you can put your camera off and I'll call you. Yeah, thanks. Congratulations to you again. Shaboni, good to have you here. You can put your camera off and just, I will call you. Yeah, please join us. And thanks. So nice to have you. So nice to have you. Okay. I'm just putting your camera off at the moment. Okay. Stop video. Yeah, that's it. So one of the things learning point is that when you're going in the exam, there will be stages or some stations where you might go blank. Am I right? Which happened to you as well. And did you think that, oh, may I
Yes,
going
sir.
to like a panic attack, whether I'm going to make it or not? Yeah, that sort of thing. When you go blank
Yes,
in
sir.
a
I mean, the
particular.
case was simple. Actually, it was a rickets. I could see that there was a bowing of legs,
Yeah.
but I that time I really went blank. I did not know, and I mean, like I felt like it was hyperpersonal rickets. Then I answered whatever they asked, but I went in between a little bit of nephro added because we used to see 24-hour evaluations. So
Okay.
maybe I didn't know what he was expecting.
Okay.
So, but that after coming out of station, that I
Mm.
really felt that I should not think about it much. I was even though my mind was going there to at that station, I knew it was not well done.
Okay.
But there's three sessions were there where I had to put my best.
Okay.
So like there was a tricky station was abdomen because there was a actually there was a scar mark in the right hypochondrium, which
Okay.
he had case was a EHPO. So
Mm.
that scar mark initially, since we don't know the history, what I said was probably some surgery of cholangitis surgery or cholecystectomy scar or something. But it turned out to be some scar due to his injury. That's what my examiner in my front of examiner was a parent. She said it's not, there's no surgery was done. It's just a injury scar which while playing
Okay.
which happened. So that turned
Okay.
away the diagnosis because if you think of cholecystectomy, then first DD would be like hereditary spherocytosis because massive splenomegaly, which you
Mm.
think of. Then I said no, it could be EHPO only.
Okay.
Yeah.
So I guess one of the things which we have learned in the past as well is that if you feel that something is not going right, as I've said to other people, when you go to the next table, you have to forget it. If your mind has a tendency to stick on that and what are the mistakes I made, but if you get stuck in that, then you will lose, isn't it? Your further next
Yes.
tables and all, you will lose your concentration and your energy will go down. So that's what you did. And it's normal for most people who pass the exam that some tables will not go as you planned. And they will be like, you will not know whether it was good or not. I think you just mentioned there was one baby where it was not sure about the diagnosis. It was more of a, you said, the not fitting into particular pattern. And there are a lot of babies with, with syndrome, but not exactly identifiable. But there, if you had, you feel that, oh, I am very panicky because I don't know the diagnosis. And very often they don't want to know the diagnosis as such. They want you to describe and even if you describe what are the features, and then they have maybe some other question. I think that's what happened in that one because,
Yes, sir.
okay.
So they just asked basically what whether basically the question actually went was they were to differentiate between autism spectrum, whether it is autism spectrum or neuroregression. So they asked me, what are the points against? Why do you feel it is not thinking ASD? Then I said it's more like I feel like a syndromic. He has a microcephaly with all the other syndromes and regression in all the domains. It was not in single domain.
Okay. Okay.
So it didn't feel like that. It didn't feel like ASD, I said.
Okay. That's good. So, I just like to ask you, what was the Devdeep has joined. He might not be at long. Dr. Devdeep has been teaching as well. So, Devdeep, do you want to very quickly say anything? Because you might have to leave. I know you're here on a short time. Anything to congratulate? Anything you want to say? Devdeep, you can
Yeah,
put your
it's a
camera.
yeah.
Ajay is here now, right in Great Ormond Street. He's joining within the next few days. He's already reached UK.
Congratulations to all of you. I mean, it's really so good
Thank
to
you, sir.
see you here, all of you today evening. Well done, fantastic, and it's a very
Thank you, sir.
good initiative for all of you. I mean, to help out the our next candidates who will be taking their exams soon by sharing our experience. I think it will be a big boost for their confidence, and will also give them the essential tips and suggestions from your end will definitely help them in the long run. So really thanks a lot from our end as well for
Thank you, sir.
giving your time to this session, even after you have finished the course and have cleared the exam.
Yeah, and
So
even
thanks a lot.
thanks a lot. And even though he's in UK, just landed there, even getting used to the system there, that's the thing. Thanks, Devdeep. I know you're
Absolutely.
busy, so but
Thank
thanks a lot for chipping in. He took time to come out. Thanks a lot, Devdeep. Okay, so with that, I'll just ask you a few last questions, really. Now, what would you say? Just say three learning points on a MRC. This journey is a journey in itself. So for some people it's very difficult, it's life changing. But what would you say was your, this whole journey? What is your learning points which you would, pass on to someone who's wanting to join MRCPCH today, who's just starting, or someone who's just starting the clinicals and finding it overwhelming? What was the few things you learned yourself first? What would you say, just on a, and now that you think back on it? Yeah.
So the first, few points which I want to say is uh, there are few days which you feel that you know things, you feel that you're knowing
Yeah.
it.
Yeah.
But again, in some days you feel that you don't know anything, and that's common to happen. I also felt, and so many of the people who were studying with me also feel the same thing. Some days you feel that yeah, I can do this. It looks easy, but some days we feel that no, I feel it's not a right decision. I think I should have delayed the exam. You also feel like that, but that's okay. It's just a it will come and go. It just could be a thought. So I just would like to give you what I was just to keep going, even though when it comes. And second thing, what we tried to do also, which we couldn't succeed, was a study group. Like if you have a
Yeah.
collective, like few people, at least two people whom we can share. Dr. Mohammed had tried to do, but I think we couldn't get time. I mean, so when I went to Mumbai, I went few days ahead. So there was one of a friend who was also giving the same center and same time. So me and him and few of us, two of us, the four of us were there, and we used to sit and we used to discuss. So they were
Okay.
also having another session from some other coaching center. So we had a lot of things to discuss among themselves, and we became the exam. We became the role player. We assessed ourselves how it was. So I think those things will help. And third thing, the last day, I would say we have to keep it for nothing. Like don't stress on the last day,
Mm.
because whatever you feel that and you're reading on the last day, it may not come, and you already know because it's just a it's they're not assessing you. Nobody asks any questions. They just they just be seeing you from the
Yeah.
behind. Even in
Yeah.
the clinical when they ask, there's only three, four questions they'll ask of basic.
Okay.
Like for me, in the AHP where they asked what could be the cause, what will you do? So by the time the bell will ring. So
Okay.
try to finish exam and you have to try to summarize your findings. That should be enough.
Yeah. So that's the important thing which you said, that people sometimes get so stressed out, they take so much time in examining that you hardly got any time to tell your thing. And by that time, then you have not left any time for the examiner to ask you questions. then you've totally lost marks on that end. Am I right? Yeah, that's what some people do.
Yes.
So as you're saying, yeah, and the question they ask, are they difficult? They're, what would you say? The questions are pretty basic, or what would you, how was the what was it compared to expectation regarding what the examiners were asking you for each table? What was the standard
Questions
of
are,
questions?
yeah, standard questions are actually basic only, sir.
Yeah,
Like even for
yeah,
examination also, they didn't ask anything. Like we mean, for the clinical examination, I was doing general physical. They said, no, no, no need. You go for clinical direct.
okay,
So it was like that. And they used to, probably they used to cut short. They just asked what is needed.
okay,
Even in the cardiovascular, I was did examine that they asked few questions regarding RHD, because rheumatic disease. So they asked what murmur you found. So what about the prophylaxis? It's all basic what we read there, and yeah, that should be enough. So they don't ask for any hi-fi questions or any.
okay,
They don't expect, and you do sometimes you don't find that we that 9 minutes goes very fast. We feel
yeah,
that you have 9 minutes,
absolutely,
6 minutes. You finishing with 6 minutes, they'll give you a bell. But before that, you can start discussion. That's good. We try to. I could try to start discussion before the 3 minute bell. But even the questions, by the time you answer, it will be like one or two questions only.
yeah.
It will
So
be.
not many questions, not many time for the questions, but you have to leave time. And as I said, I feel everyone, I tell to all the candidates that time, like Einstein said, no, I tell again and again to people, time is very relative, isn't it? Time, what you're feeling now, and when you go in the exam, is going to be 10 times faster, isn't it? It will just, am I right? When it feels that time is running, even though you're prepared for it, doesn't it feel that time is rushing so fast when it's too fast? So unless you are getting used to practicing again and again, uh, I think the time factor is one of the things where most people struggle. Am I right? That was one of the things to keep a very good control of, or at least to be aware about. And were you missing the knocks on the door, or because a lot of people miss that, or the warning that 2 minutes is left. Three, you got anything to say about that? What was happening with those warnings, warning knocks?
No, sir, it was pretty obvious. They used to knock
Okay,
and they used to open and this is say 3 minutes left.
okay,
So it was very obvious actually,
yeah.
knock, sir.
So you have to be aware of that and try to summarize by that time. That was one thing.
And even
Okay,
especially in communication also, whenever the knock comes, probably we should try to, what is role play is saying, then we try to address and then we try to summarize within the time.
okay, okay,
So that helps when they after the knock,
okay.
especially.
Okay. Thanks. So I'll come to the end now. So how did Dr. Academy, how did you come to know about us? Dr. Academy, what was it which brought you to our world? And what really helped? Very specific things I want to know why Dr. Academia made a difference to you. These are the things which really we need to know really. So how did you
Uh,
come to know about us really?
so through Telegram group, I had joined the Telegram group much
Okay.
earlier.
Okay.
Then one of a senior was a friend who had joined this, I think, the last time when he had given. He suggested. So then I contacted you for during the June. I mean, during August, I contacted
Yeah.
you.
Okay.
That time I wasn't sure that I'll be taking. I thought, anyways, I was sure that I'll be going out for the job. So I thought maybe I was, when I met you at the conference also, I was in dilemma whether I should take here or I should
Yeah.
give there.
We had a chat.
So it happened. I just applied and I got through. Then I finished. That's luckily everything happened in a way like that.
Absolutely. Absolutely. So
So
it all worked.
I
Yeah.
felt that I felt help from Dr. Academic Group mainly through the those teachings by Umbra ma'am, who was like in which we have taken the hot seat and we have
Mm.
examined, and even the short clinicals, Rana sir and communication by you. It all helped. It all
Okay.
made us prepared as a way like what kind of scenarios it will come. Even though some scenarios may change in the like it may be very difficult. Like in communication, I got a preterm delivery, preterm child who is getting discharged to counsel. So there may be some different scenarios, but we know what we have to say. We know the gist, and it will be easier when you face the exam.
Okay. So you got a fair, good understanding of what the exam was. And when you did the mock exam as well with us, did you? Did you do the mock?
No, sir, I did not.
Oh, you didn't get a chance for
No,
mock
sir,
exam. Okay.
unfortunately.
Okay, so that's good. Anything you would have done differently in your preparation? Suppose now that you've done it and some you started again or you had a chance again, or suppose you had gone back in time with this knowledge, was there anything or you would advise your future candidates to do differently now with the knowledge you have of the MRCPCH, having gone through the journey? What would your last words be to the candidates in their preparation?
Um, So I would suggest, I would say to my those who are preparing now, to take out time daily so that you, and mainly it's during you're practicing every day, you're seeing every day. So probably one or in sitting in OPD, 1 or 2 cases, you have to time yourself to see in 6 minutes. You do a general physical examination, and then you do this system. So that practice is going to help, that which you could do. And even the communication part, when you're taking rounds, so you can try to communicate like how you're doing in a normal way, like exam way. So you talk to them that was there anything you want to say. So all those things will help, because I think even the small things what we bring the change, through a practice, it will going to make a big impact when you give exam. So that thing which you could do, which I did, and because I mean in the last I didn't work for some time, so I missed out on that. Then the second is having a study partner, or someone who is accountability, like what sir used to suggest.
Yeah, yeah. Accountability partner.
So that helps a lot, because even if you're not studying, the other person is studying, you're just listening, then even you will learn from the other person. So because when I went a few days before to Mumbai, that's what I was doing. When me and my friend were reading, he was reading, then I was listening. So if we teach each other, you will learn more. So
Okay. So these are the
that's
findings.
what I want to say.
Okay, thanks a lot. You've been very kind, Ajay, that you've been so busy. You just landed from the UK. You landed in, in the biting cold in Great Ormond Street. You don't, and I know you're searching for accommodation. Very hectic. Keep it. Thanks for that, and best of luck for your journey ahead. And what I'd like to say, Ajay, keep in touch with us. What we are going to
Yes,
do,
sir.
I know you'll be busy, and obviously get on. I'm sure you'll do very well. We've got colleagues there as well, and I will create a group where I would like some of you guys to be mentors, so that when you have the groups here, when you are free, just 1 or 2 words of advice, because you're in UK, right in the middle of it. And I'm sure everyone here would appreciate that. They might have, because now you will be in the UK, you will be working there, you will be seeing how things are different there. And so if you don't mind, I will be keeping you in one of our groups. Yeah. All you have to do
Yes,
is,
sir.
when you get a minute and if someone has a question, that would make a lot of difference for us. Yeah. Would that be okay?
Yes, sir.
Okay. That's very kind of you. So thanks. I won't hold you back any longer. I know
Thank you,
you've got
sir.
lots of stuff to do. Over to you. Thanks a lot. So I'll stop this recording now.
Thank you,
Thank
sir.
you
Thank
so
you,
much.
sir.
Thank you. And so I know you got busy. So if you want to go, that's fine. Okay. I'm sure you've got lots of work.